Well, hello everyone. Thank you so much for joining us. We have participants trickling in, but while that is going on, just wanted to start with some introductions to make the best use of our time. I know you all are busy, so appreciate you joining us. So this is our Fast Fact webinar series, or the Public Health Allied Clinician Talks. Today we're going to be talking about back to school and the IDPH Children's Agenda. I'm Jennifer Sa. I'm the Pediatric Medicine Medical Advisor here at IDPH, and I am part of the Medical Services Division, which is the team that has been bringing you these Fast Fact Talks. So it's under the leadership of our Chief Medical Officer, Dr. Arthi Barnes. We will be sharing the slides after the presentation, so feel free to check out our website, contact us if you need to. But our team is basically here to provide medical consultation, not only for IDPH, but to also serve as a liaison with all of you in the healthcare world. And thank you for all you do and your partnership to help us protect the health of Illinoisans. So in terms of speakers today, I am so pleased because I am joined by Julia Strelo, who is IDPH's Senior Advisor to Director Vora. We also have Dr. Dana Weiner, who is the Chief Officer for Children's Behavioral Health Transformation for our state of Illinois. And then that's me, Jennifer Sa. I'm, again, Pediatric Medicine Medical Advisor here at IDPH. We are very happy, as with all of our Fast Fact webinars, to be able to provide CME for those who need it. And per protocol for CME webinars, none of us have any financial relationships to disclose. Just one point of housekeeping, this webinar is being recorded. It'll be shared with you as well as the slides from the presentation. If you do have questions during the webinar, don't hesitate to ask them. We just ask that you put them in the Q&A portion of WebEx. In case you are not familiar, just click on those three dots at the right lower corner of your screen and you'll see the Q&A area. And then we'll be sending out a survey to those who attend so that you can fill it out and get your CME credit. In terms of our learning objectives today, so again, we're talking about children and back to school. So we're going to be identifying some of IDPH's child health priorities. We have a really exciting new tool to connect children to behavioral health services called Beacon. So Dr. Weiner will be talking about that. And then I'll be reviewing some key components of the child health examination, including immunizations and lead screening. So with that, I will pass it over to Julia.
Thank you so much, Dr. Sa. Hi, everyone. My name is Julia Strelo. As mentioned, I serve as an advisor to Director Vora here at IDPH. I am a social worker by background. I've worked here at the Department of Public Health since October of 2024, but prior to that, I served the state of Illinois at the Illinois State Board of Education for a few years, working on school mental health, and have previously worked with children impacted by trauma in Chicago. So I'm excited to be here today to give you a brief snippet of our public health agenda for children, which is something that we are in the process and building in an ongoing way. We're going to share a little bit of it today with you and then feature some more content, as mentioned, about Beacon and about back to school and healthcare for children. So next slide, please, Jen. As you might know, Director Senior Vora, our Director of Public Health, is a pediatrician by training and is interested in really finding a way to coordinate and improve public health programs that serve this important population of young people in our state. And so we've built it to recommend long-term opportunities as well as streamline and coordinate what we're currently doing to build a better foundation for child health outcomes, both across the public health space in Illinois, but of course with all of our interdisciplinary partners, like those in behavioral health and those in other sectors, including schools. So the children's agenda is rooted and aligned to something called Healthy Illinois 2028, which is our state health improvement plan, which has these 5 priorities that you see here listed on the slide: chronic disease, emerging diseases, maternal and infant health, mental health and substance use disorder, as well as racism as a public health crisis. And the agenda is also built with the values of health equity, collaboration, and community at the forefront. So I'm going to talk to you in a minute about a couple of agenda items that we're featuring today, and hope to potentially bring some more of them back in another webinar in the future as we continue our work to build this agenda for children. So next slide, Jen. We have 3 domains of focus for the children's agenda that we've built: growing bodies, developing minds, and connected care. I think that all of you listening are likely very aware that childhood provides a very important developmental window, as it's often called, to impart upon children and their families prevention services and other interventions and programs that can really lead to a lifelong built up network, both in a community that surrounds a child, but also internal to that child's brain and their body. And so we're really hoping that by having this focus on these childhood programs, we can really impact the future of health for all Illinoisans and residents of our state as well. All right, so next slide, please, Jen. So I'm going to talk about a few just introductory items, and then you'll hear more about them from the 2 featured speakers here in a moment. So one of the things that you may have heard about in the news this year or recently in a press release and a siren that IDPH put out is that one of our big roles in public health is to prevent lead poisoning of children. IDPH is implementing across this year lead poisoning intervention using a new and more stringent threshold of 3.5 micrograms per deciliter. It used to be 5 for when a family receives services after the return of elevated blood lead levels. So we have been collaborating across offices to enhance and discuss the intervention strategies that are used, as well as improve some of our prevention materials to further prevent exposure and to increase education across the healthcare community as well as other communities. So Jen will talk a little bit more about that in her section. And then next slide, please. She will also talk about our goal in the children's agenda of increasing childhood immunization rates. So obviously this is quite an important topic for public health. We have been implementing data-driven interventions to address vaccine hesitancy and increase immunization access and completion across the state. We've been very busy, especially this spring in light of the measles outbreak that did occur, but is now over in Southern Illinois. So you'll hear a little bit more about that from her, including collaboration that we have done a lot with schools. And both of these 2 items that Jen is going to talk about, preventing lead poisoning and increasing child immunization rates, she'll frame up around the child health exam, that back to school exam, and the importance of addressing these things during this time and as we get into late summer and early fall. Finally, and actually next in our order of speakers, you're going to hear about Beacon from Dr. Dana Weiner. She leads the Children's Behavioral Health Transformation Initiative in Illinois and will tell you all about this exciting new portal that you can help your patients and families access to learn more about behavioral health care available to them in Illinois. Before I turn it over to Dr. Weiner, I do want to say one final thing just to kind of frame this conversation for everyone, to remind all of you as healthcare providers about the importance of really understanding the school landscape in Illinois as you work with children and families. You may or may not know that Illinois has 866 different public school districts overseeing almost 4,000 public schools. And that serves a total of 1.9 million children as early as age 3. And depending on when a child graduates, they can actually be served by this system until they turn 22. But traditionally would graduate, senior year of high school at 18. So that's a lot of different systems interacting together. And you may see a variety of patients from dozens or hundreds of these public school districts and school buildings in Illinois who all are interacting with different healthcare systems that are set up in their schools, either to serve their health needs or to serve special education needs. So I put a few more just really interesting points of frame for you and how critical your provision of services is to kids as they get ready to learn and are entering the school day in a healthy and prepared space. The ratio of students to certified school nurses who have a primary focus on special education or students with IEPs is 1,531 students to 1 certified school nurse. So that's of course not a great data point, but just a reminder for you of how they're really not going to get their healthcare needs met at school in the way that you can in your primary care offices. There are, in addition to those certified school nurses, hundreds, if not thousands, of other registered nurses who are employed at schools that work on whole school health and may see a kid, day to day if they come to the nurse's office. We also, of course, have thousands of young children served by public and non-public early childhood education programs in Illinois, including daycares, and thousands of elementary aged and young children that are served by non-public schools, whether that's a private school or a homeschool setting. So just wanted to kind of frame up the landscape of schools in Illinois for you to think about. I'm going to turn it over to both of my colleagues, Dr. Weiner and Dr. Suh. Dr. Weiner will go next, and will please feel free to enter any questions you may have in the chat. Thank you.
Great, thanks, Julia. It's great to be here with you and Dr. Suh, and to be working alongside you both as we make progress toward transforming the larger system for children's behavioral health care in Illinois. So let's go to the next slide. I'm going to provide a little bit of context for the tool that I'll be talking about in a few minutes. I'm Dr. Dana Weiner. I'm a clinical psychologist, but a researcher in practice, and have spent the last 25 years or so working alongside of child serving agencies, DCFS, DJJ, DMH, in Illinois and across the country to try to implement transformational change. And since 2022, I've been working out of the governor's office on transforming children's behavioral health in Illinois, with a focus on closing gaps in services, improving the agency's ability to work together, and providing more seamless experience of care to families. And Beacon, the tool that I'll be talking about, is a key component in that. So let's move to the next slide. So, and you'll have to click 6 times, I think. So this work is an effort to knit together the work of 6 state agencies in Illinois that serve children, or either directly or indirectly. That includes DCFS, the Child Welfare Agency, DHS, which, and I need to update this slide because the Division of Mental Health merged with the Division of Substance Use Prevention and Recovery. And there's also the Division of Developmental Disabilities, as well as Family and Community Services, all at DHS. The Department of Juvenile Justice, the IDPH, obviously, and the Illinois State Board of Education, which you just heard Julia describe, as well as HFS, the State Medicaid Agency that I'm sure you're all very familiar with. So let's go to the next slide. Those 6 agencies are responsible for implementing the 12 recommendations in the Blueprint for Transformation. The blueprint was released in 2023, and shortly thereafter, the governor issued an executive order saying that we as a state would implement this plan, and charging me in this role of chief officer with leading this implementation. But this is a complicated and multifaceted set of tasks, these 12 recommendations. 4 of them have to do with centralizing and streamlining access. 4 have to do with adjusting capacity to deliver services, and 4 more have to do with allowing us to get upstream of problems so we can intervene earlier to avert more serious crises. So if you go to the next slide, you'll see how we're doing on these, and we routinely track our progress on these 12 strategies. And I won't go through this in detail, but you'll have this recorded, and you'll be able to have access to these slides so you can see how things are going. This graphic is color-coded according to which agency is responsible for implementing, for leading the implementation, and each of these agencies has a partner, a Chapin Hall researcher, policy analyst, that is helping to drive that work and guide the implementation. And so some of them have longer runways than others. Implementing universal behavioral health screening in schools, for example, was projected to take about 5 years, and it will have, but some of these things we completed more quickly. So let's go to the next slide. So there are a number of things that are either ready or on the horizon to support pediatricians. So I just thought I'd highlight 3 of them. Beacon is what I'll be talking about today. We'll get to that in more detail in a few minutes. We also are working with HFS to procure a robust service referral system. Right now, we rely on a tool called Spider that is curated by Northwestern University under a contract with DCFS. But the new system, which I believe will be called iCars, is going to be procured by HFS in order to leverage Medicaid dollars to build it. And that will be of use to all of you as well. And you'll be able to do closed loop referrals and make appointments for families. I envision it to be like the open table for outpatient treatment. And then also, and Julia is leading this work as our IDPH partner, we are rebuilding community networks. Some of you may remember the LAN infrastructure that meant that communities met with interagency involvement regularly. And in some communities that still happens, in others it doesn't. So we're working to rebuild that in partnership with IDPH. Let's go to the next slide. Okay, so I am going to give you just a taste of Beacon. If you want more information, you can get it on our website. And I think Julia mentioned our website too, but I can put the links in the chat when I'm done speaking.
I'll do it, Dana. I'll put the links in the chat now.
So you can get more information on our website, including, if you go to the next slide, you can get flyers about Beacon that you can hand to families in your offices, translated into 7 languages. Beacon is available in 7 languages, and we have flyers about it to give to families that are translated into those languages. So you can find all that information as well as instructional videos and other descriptive materials on our website. So let's go to the next slide. Told you I was going to go fast, Jen. So this is what the homepage for Beacon looks like. It can be accessed at beacon.illinois.gov. And Beacon does a number of things. It lets families access information about services that their kids are eligible for. It lets them actually create an account where they can submit a request for help and then track the status of their request. It lets them upload documents to that account so that they don't have to be sending or faxing materials or emailing materials to various service providers. And it is essentially a routing tool. So it knows and can automate recommendations about what kids need based on what parents report problems are. Let's go to the next slide. So this is what it looks like if parents create an account in Beacon, and this would be appropriate to give to a family who was struggling to manage children's behavioral health issues, needing help, whether those kids have developmental disabilities, whether they have more severe problems and are in need of residential treatment, or whether they're in need of outpatient treatment. And parents have the option to use Beacon by creating an account, but they can also use it anonymously. And you can create an account for a family and report on the youth issues, but it'll be the family that will get the phone call, because Beacon only works when parents give consent for someone to contact them and for the agencies to collaborate. So let's go to the next slide. The question about whether the slides will be emailed, I believe the slides will be available, but I think that's a question for Dr. Suh, maybe. So as I said, anyone can use Beacon without creating an account. If you are just looking for community-based services, there's a list of links that on the previous slide, there's a list of links that through which you can access those different service directories. But if you provide information about a youth in Beacon, you will get an automatic list of services, and that's being pulled from that Spider system I mentioned. And then once those programs are offered, you'll be able to click on each program for more information about the program. Now you can go to the next slide. So as I mentioned, Beacon also is a way for families to get a call back from a human being to help them navigate the service system. Now that could mean their child needs an IEP, an individualized education plan, and they need someone to talk them through how that process works. It could mean that they are having trouble understanding what resources are in their area, and they need a resource coordinator to contact them to help them understand how to get connected. For any kind of request to be contacted, families are asked if they need more assistance, they indicate yes, and then they're given a receipt that someone will contact them in 24 hours. And we actually have access to a set of dashboards that show us that everybody receives a call within 24 hours. And I can tell you that probably 400 to 500 families are accessing Beacon every day, and about 4 to 6 of them are saying, please call me. And those calls are happening daily. Let's go to the next slide. Beacon is not a 24/7 crisis tool. We have 988 for that, and of course 911 for other emergencies. So if someone goes to Beacon and they're dealing with a crisis, there's actually a button on every page of Beacon that says, click here for crisis help. And if you click there, you're shown the resources that are available in crises. Let's go to the next slide. As I mentioned, Beacon is available in 7 languages. They are listed here: Arabic, Hindi, Polish, Chinese, Spanish, Tagalog, and Ukrainian. Let's go to the next slide. Okay, this is the team of people who will respond when a request is made. They are all situated in the Division of Mental Health and in the Department of Human Services. They report to Lisa Betts, and they consist of a set of resource coordinators who are kind of generalists. They will call the family back and find out what it is they're looking for. A team of clinical specialists, each one geared toward a specific subgroup that we noticed tends to have a unique set of needs. So there's one for internalizing problems and self-harm, one for externalizing behavior problems, one for juvenile justice involved youth, one for youth with developmental disabilities, and one for transition age youth. And then we have some parent navigators who can help parents navigate the process of getting an IEP. Let's go to the next slide. So the next set of slides show you what it looks like when you actually use Beacon. So I'm going to ask Dr. Suh to just quickly click through them. But again, you should have access to this deck, or I can provide these for you, or you can find them on the website. So you can see what it looks like to use Beacon. I just want, in the interest of saving time for everyone, I'm not going to spend too much time on them. It's relatively easy to use. You're asked to indicate what these issues are, what services they may already be receiving, what their funding type is. You can go with one more. And then they're given a list of services. So I think I only have a couple more after this. I just inserted these so you would see a simulation of what it looks like to use it. Okay, so parents are, as I mentioned, are using Beacon to navigate the service landscape, to create a case for immediate support, to track the progress of their request, or to request help from someone. If you go to the next slide, you'll see we've just kind of summarized how pediatricians are using Beacon. Pediatricians are using Beacon to help a family while they're in the office to see what services are available in their community. You can print out a list of those. And they are also using Beacon to connect families to more specialized services. So if a youth needs residential care, let's say there's a youth who's hospitalized and is waiting a residential treatment bed, that you can, by entering that case into Beacon, get help from all of those 6 agencies I mentioned in expediting that hospital discharge. And you can also use it to raise your own awareness about the state-funded services. I am just about done. Let's go to the next slide. These are just some tips, just 3 things to leave you with. If you are searching for information on behalf of a family, please provide them with the entire list of services that you are able to get from Beacon. I know I get asked for referrals all the time, and I tend to kind of just give 2 or 3, even if I get a list of 10. We want to give families all the resources because you never know if the first 2 don't work out, and we want to empower families to make choices among the whole list. Also, if you request additional help for a family, please warn them that someone is going to call them. People are surprised by this. They don't usually get a call back from a human, but they will. And so it's important that you warn them, and also important that you let them know that none of their information will be shared until they sign a consent. And they can do that electronically in Beacon. If they can't do it themselves, when the resource coordinator calls them, because all they'll have is their number of the caregiver, they will talk them through that process, and only then will they be able to unlock and see the information that's been entered into Beacon. So that's all for me. The last slide is just a QR code in case you want more information from us or want to be on our mailing list. You can scan that code that says scan me. If you want to read the blueprint, you can scan the other one, but we'll put the link to it in the chat, or maybe Julie already did. So I will hand it back over to you, Dr. Seth. Sorry, I hope I didn't take too much time.
No, that was wonderful. Thank you so much, Dr. Weiner. All right, so I'm going to talk about the school child health examination or the school physical. I will say I really love school. This is like my favorite time of year, so really excited to be talking to you about this aspect of it. So the school health form, most of you are probably well aware of it, familiar with it. I know it's undergone some changes over the last couple of years, but want to give you a sense of why the school health form is needed. And hopefully after our webinar today, I know sometimes when it's a busy clinic schedule and last minute a family's like, wait, I need this form filled out. You might be going, why? But this is why. So schools need that information. This is really important information on the student's health history for school nurses and other health personnel. It will help them in case there is a medical emergency at school. If there are medications that the child needs to take at school, it gives the school a sense of what they need to be doing in terms of collaborating on chronic disease management. Sometimes they might look at it as they're looking at other things related to an IEP or 504 requests, and also to see if maybe there are some referrals that the child might need. So again, this is like the way that on paper you are starting this relationship and partnership with the school towards ensuring the child is healthy. For public health, really important information. So one is health protection, right? We want to make sure children have their vaccine preventable diseases covered. So through their immunizations, we want to make sure that those who need TB testing have gotten it, want to make sure that we are preventing lead poisoning. So health protection, but also this is really important data that we can't get anywhere else. So really, I'm speaking about the immunizations data. This is the most comprehensive information about who and how many people in Illinois are vaccinated. So thank you for all the work that you do to get our students vaccinated and for providing that information on this form. And then it's a tool for you all as clinicians, as you are having conversations with families and discussing and making sure that they know that these screenings are important, vaccinations are important. So hoping that it is a conversation starter and a tool to help you do those conversations with families. In terms of the requirements, so when do kids need the forms? So required by law within 1 year before in terms of the exam, before entering kindergarten or first grade, because the child has to enter school by the time they're 6 in Illinois. So some kids will enter in first grade when they're entering 6th grade, when they're entering 9th grade, and then if they're entering a school for the first time in Illinois at any grade, they need to have this exam and they need to provide the form. I'm not going to talk in more detail about the dental exam and the eye exam forms, but just wanted to make sure you all were also aware of that as you're engaging with families. It's good to remind, especially the kindergartners, that they need to have the dental report completed by a dentist. And the eye exam, it's not just the simple, read off the letters on a chart or any exam that you do in your office. These do need to be completed by either a physician who performs eye exams, so in other words, an ophthalmologist or an optometrist, and again, required for kindergarten. I'm not going to go in detail about the immunization requirements, but generally they follow the CDC schedule for childhood immunizations. I just wanted to flag that we do have a website where all of the requirements are listed. So if you need to double check in terms of what is legally required for a child to be in school or in a childcare facility, go to our website. We will be sharing these slides, so you'll have access to the link. You'll see it says 2024 to 2025. There are no changes in the requirements for this upcoming school year. We'll make sure that that date is updated on the website. So again, like I said, that information that you provide on the form is so important. This is the most comprehensive data that we have about our Illinois residents and our vaccination rates. We've been hearing a lot about measles this year because we have that impressive rise in cases, the highest number of cases since we declared measles was eliminated in our country. And we had a few cases here in Illinois, 10 total. We've not had any new cases since the end of May. But again, another reason why it's important to keep talking to your families about vaccination. This slide here is showing our measles vaccination rates. We have our school vaccination coverage dashboard using the information that you provide on that school health form. The schools then submit it over to the Illinois State Board of Education, or ISB, who are close partners with us. And then we receive the data and we put it on a dashboard. Again, the link will be available on the slides that you receive, but this is measles. So you can see that the school vaccination rate this past school year compared to the one prior, it was about the same. We've had a steady decline in our vaccination rates starting around 2017, 2018. This is mimicking what's happening across the nation. So something that we want to change in terms of the trend, we want that trend to be going up. We're hoping maybe we have stabled out and now we're going to be increasing. And just again, thanks in advance for all the work that you do to get your students vaccinated. The map shows the percentage of vaccination for each county. So our goal is over 96% of students being vaccinated. And then, so that's the blue. If they're between 91 and 96%, that's yellow. And then under 91% coverage, meaning they're really high risk of having an outbreak in their school. If a case is introduced, that's in the red. So you can see that there's a smattering of yellow across our state. There are some red counties down below, and we've been working really closely with our local health departments and with some of the school districts to get those vaccination rates up in those areas where they're not blue yet. The other thing I wanted to flag is that Illinois has been under the US average for kindergartners having the MMR vaccination. We don't want to be under average, we want to be above average. I will say the rate has stayed about stable from last year. We're still waiting on CDC to post the data so we can compare ourselves to other countries or other states around our country. But 2023, 2024, only 91.6% of kindergartners had both doses of MMR. During that school year. So again, work to be done. The other tool I wanted to just make sure you all were aware of is our new measles outbreak simulator dashboard. I think what we found is numbers are numbers, but sometimes it's hard to translate what does 91% mean in terms of coverage. This dashboard will actually take a school's enrollment, the vaccination rate, and then it'll give a prediction of what the chance of having a large outbreak is and how many cases it'll involve. The dashboard, if you scroll towards the bottom, actually also kind of maps out the duration of the outbreak. So another tool that we hope you will check out as well. And if it's helpful in your conversations with families, if they're on the fence, you can show them, hey, this is the chance of your school having a large outbreak, and this is how long it will happen if someone with measles comes into the school. We've been engaging really closely with all of our school partners, and we recently sent a survey to those schools who had lower vaccination rates just to get a sense of their measles outbreak readiness, making sure they had resources. And we also asked them about barriers to vaccination that they're seeing. You can see that by and large, the number one reason that folks cited from the school standpoint was religious objections, and I'll talk a little bit more about those. But I also wanted to highlight that, there were concerns about access to healthcare and cost concerns. Don't forget, we have our VFC program, or Vaccines for Children program. If your clinic is not signed up, please reach out. We would love to get you enrolled. This is our program that ensures that children who are covered by Medicaid, who may be under or uninsured, children who are just at higher risk of not being able to access vaccines have access. These vaccines are provided to you at no cost to the families who need them. So if you're not already enrolled, please reach out. We'd love to get you enrolled. I did want to flag, it was only 4.2% of school respondents who said that providers weren't vaccinating according to the recommended schedule. But of course, that's why we're all here today, to remind ourselves of making sure that we're up to date on going to those resources for the recommended schedule. And again, that IDPH website is available if you need a check on what is recommended when. So more on the religious exemptions. So you may have heard exemptions across the nation are rising. It's exactly the same here in Illinois. So this is available on our dashboard too, and you can actually look at it by county, by school, but the green bars are religious exemptions. So our state does not have personal belief exemptions, so something to keep in mind as you look at this data. You can see that this past school year, over 18,000 students had requested a religious exemption. That's compared to over 14,000 the year before. So we are seeing a steady rise. The other bar, these are the other types of exemptions that a student can have. So the blue is an approved schedule, meaning maybe there is some reason why someone can't get the MMR right then. Maybe they are in some kind of immunocompromised state. They can't get MMR, but they will get it later once that condition is gone. So that is an approved schedule. I'll talk a little bit more about what you all need to do as clinicians to request those types of exemptions. The red ones are medical reasons, so an allergy or some reason why a child can't get vaccinated, period. And then the orange are McKinney-Vento Act exemptions. So these are students who are homeless or have unstable housing. We don't want them to not be able to access education because they don't have access to records or getting their vaccine. So this is an exemption that's given to them. It doesn't mean that this is a forever exemption. It just means you can come to school and the school will actually work with these students to get them connected to resources and to vaccinations as well. So in terms of the exemptions, so the religious exemptions have to be requested on our state form, and you can find this on our website. Hopefully you have access to these too. It is the family, the parent or guardian does have to put like vaccine by vaccine the reason why. Just wanted to restate again that by signing this form, so a healthcare provider must sign the form. You're not saying that you affirm the parent or guardian's beliefs. You're not saying you agree. You're just saying that you counsel the family on the importance of vaccination and what the risks are of not getting vaccinated. The other thing I should mention is any child who is exempted from an immunization, if there were to be a case and there needed to be quarantining, an exemption doesn't mean you're exempt from being quarantined. So these students will still need to, for example, if they're exposed to measles, they will need to be quarantined and exempted from coming to school. So another thing to make sure your families are aware of. You don't, as a clinician, determine whether a religious exemption is valid or not. You simply ask the family to complete the form, you give your counseling, and then you sign the form once you've done the counseling. The local school authority will determine whether the form was completed correctly. Medical exemptions and alternate schedule requests, those don't have a separate official form. You just need to write a letter explaining why. And if this is a temporary condition, when you anticipate the child being able to get vaccinated, and then you need to sign it. The other thing I wanted to flag is that all of these exemptions, whether it's the religious exemption form or the statements for a medical exemption or alternate scheduled, they must be signed by the same healthcare provider who's completing the child's school health examination. So the person who's filling out that school physical form also has to do the exemption. A family can't approach a different provider and get an exemption form signed if that person did not also do the full examination. So just something to keep in mind as well. So that's immunizations. I also wanted to talk about lead. So as Julia mentioned, this is one of our priorities. Hopefully you all saw that we have added additional high-risk zip codes. Oh, yes.
I'm sorry to interrupt you, but I wonder if I could just point to a couple of things that came in the chat about immunizations before you get into lead. Is that okay?
Sure, yeah, happy to answer those.
One of them is that we just wanted to emphasize that a lot of these get turned into schools with the parents not filling the top part out. And so people were just commenting about how important that is. And sometimes the form prints out blank. So there was one question about an out-of-state physician completing the form. And I don't know the answer. So can an out-of-state physician complete the health exam form? And I just wanted to either say that we would get back to these folks with the right answer, or if you know, it sounds like if it's the Illinois form, it is okay for an out-of-state physician to complete it. Do you know, or should we confirm and get back to folks?
We should probably confirm. I know that they have to be a licensed physician, nurse practitioner, or physician assistant. I had always assumed that meant licensed in Illinois, but let us check the exact language and get back to you.
We'll include the answer to that when we send out the PowerPoint. And then thank you for that question. The other one that I just wanted to, someone asked about the name of the Vaccines for Children program. So I think that got addressed. But then also, let's see, are the exemption forms good from kindergarten to 6th grade when the next set of vaccines are due, or do they need to turn in the exemptions every year?
That is a good question. I know for alternate schedule, if you put like this child should have been vaccinated by this date and they haven't, then someone will follow up, like a school nurse or someone, to get an additional. The religious exemptions, I mean, these are required only at those specific grade levels. So I believe that once you submit it at that grade level, then, for example, a religious exemption, then that's it. And then when you go to sixth grade and you have to do the forms again, that's when you would have to submit another exemption. We can also clarify what is recommended or done in practice.
Yep,
But
and
if you do an alternate schedule for sure, or if the child's medical status has changed, you should be vaccinating the child, or would need to write another statement saying why the child couldn't get vaccinated in the schedule you had proposed.
Yeah. Okay, thanks. I'm gonna let you move on to lead, and we will, people are agreeing with you in the chat about the timing, but we'll let you get back to lead and then see if we have other questions pop up. Thank you so much, everyone.
Great. Sounds good. And I guess one thing I will say is, we saw it in Texas and New Mexico. We heard that families who had actually submitted religious exemptions in the setting of that outbreak, they were like, well, does this mean I can never get the vaccine? So if you encounter families who did request a religious exemption, I would suggest every time you see them to revisit the vaccinations, because maybe they've changed their minds. So just make sure that they can get vaccinated if they want to. I guess that is the point there. So even if someone requested that exemption before, doesn't mean that they can never get vaccinated. So keep talking with your families about it. All right, so talking about lead, so we recently added some additional high-risk zip codes. That high-risk zip codes are determined by an algorithm that our department has come up with. It includes, looking at how many older homes with lead paint and other lead substances are in existence in that area, how many, inspections saw lead in the area, and also, have there been many children who have elevated blood lead levels? And so it kind of looks at all of that and then determines, and there's a score. And then if a zip code has a particular score, they're considered high risk. So a lot of the state is high risk. All of the city of Chicago is considered high risk. So something to keep in mind. I think, so this slide here is comparing Illinois versus the United States in general. And you'll see the blood lead level threshold on this slide is 5, but the CDC and Illinois, the threshold is now 3.5 or higher for an elevated blood lead level. This is all to point out the good news is the percentage of children tested who have that elevated blood lead level has decreased over the years, but we have been above the US percentage. So again, higher risk in Illinois compared to the rest of the state, which is why we really want to work on this, because we want to try to get to zero. We want to eliminate any childhood lead poisoning and elevated blood lead levels. This I just wanted to show you as well. You can see, again, the good news is in the previous decades, we saw a lot of kids having really high blood lead levels. That has decreased. And we've seen a decrease even for that over 5. So the work that all of you are doing to test and refer, that's all working. Now with the threshold being 3.5, we still have a lot of work to do. So again, this isn't an issue that is over, it's ongoing, and we really want to try to get as many children connected to services, follow up, because as you all know, there is no level of lead in the blood that is safe, and we want to make sure our children are healthy and developing well and all of that. So the thing to note too is that we did see a decrease in lead testing during the COVID-19 pandemic, and like our vaccinations that decreased, lead testing did too. And then so this is showing the state of Illinois. The darker gray are areas that had a greater decrease in testing during the pandemic. And then at the same time, there was a rise in cases of elevated blood lead level, in part because the threshold changed too. But I think the important thing here is don't forget that testing. I know sometimes there are some challenges, families may leave before getting the test, but really important to focus on lead testing and making sure our children are getting tested if needed. In terms of the screening requirements, so this is what's required by law. So children 6 years and younger, they need to have documentation that they got screened and or tested. This is required for children 1 to 6 years of age before they're entering daycare, nursery school, preschool, or kindergarten. And then we also have our Lead Poisoning Prevention Act that says that clinicians must screen children 6 months through 6 years of age following the American Academy of Pediatrics guidelines. So again, don't forget lead testing. It should be part of all of your well child check routines, but really, really important, especially given that we have a higher percentage of children here in Illinois as compared to the rest of the country having elevated lead levels. The other thing to note is if a child is 7 years or older, if in your medical judgment, based on their history, they're potentially at high risk of lead poisoning, you are also required to screen. So when do you need to test? So there's this screening. I just really want to encourage all of you, if you're not already, to make sure you are using our screening form. It is very, very user-friendly. It's like a map. It kind of like tells you when a child needs to be tested or not. You don't have to remember it all in your head. It's all on this form, so just turn to this form. And this is also the screening that you should be using to determine whether a child is high risk or not. So when should you test? If a child is living in a high-risk zip code, so the backside of the lead screening form that our department issues will have the list of the zip codes. So if they're in a high-risk zip code, if they're 12 months or 24 months, you got to test no matter what. If the child resides in Chicago, you should also be testing them at 3 years of age. But if they're not in Chicago and they're ages 3 through 6, you should use a lead questionnaire. And if based on that, they require testing, or if they've not been tested at both ages 12 months and 24 months, you should test them. If they're living in a low-risk zip code, you should use that questionnaire. And again, if the questionnaire leads you to must test, then you should test. The other thing to keep in mind is all children who are enrolled or eligible for Medicaid or any of the HFS medical programs, they must be tested at 12 months and 24 months. This is a lot to keep up with. So just want to also highlight, and you'll have the link to get to this page, but there is a nice table that our lead program has outlined the testing requirements based on whether they have Medicaid, high-risk zip code, low-risk zip code. So the tools are all there, but the important point is please make sure you are screening and testing your children for lead. In terms of the public health response, so just so you all know what happens, all lead testing results must be reported to IDPH. We do get all of those levels from the lab, so we are getting an alert. But if you are doing, for example, the capillary testing in your clinic, make sure you are also required to report those. And these are normal results and abnormal results. An elevated blood lead level, again, is 3.5 or higher. It's no longer 5 or higher, it's 3.5 or higher. And then every child who has a blood lead level of 3.5 or higher, again, we do receive those results from the labs. They are going to receive from public health case management, and our case managers will educate them on how to prevent lead exposure, where they might be exposed to lead. They'll give them nutritional counseling. They'll refer them to medical treatment, early intervention, or early childhood special education, or whatever other services they may need. And they'll stay in communication with you all as the clinicians. And then they'll also get an environmental lead inspection. One thing that I was asked to point out is that, and this is actually for all of our public health activities, it is so important for healthcare facilities to make sure that the patient contact information is up to date, because we depend on that to reach out to people who need a public health intervention. So thank you for all you do to work with your clinic staff to make sure that that patient telephone number, address, that those are all updated. So just quickly in terms of takeaways from this portion, and then we'll go to doing some more questions and answers. So the Certificate of Child Health Examination provides really vital information for both schools and for public health. The school health requirements, these should be a tool that you can use to discuss recommended screenings and vaccinations with families. Please continue to make sure that you're providing strong vaccine recommendations to help counteract the decreasing vaccination rates and the increasing non-medical exemption rates that we're seeing. Renew your focus, if you haven't already been doing this, on lead screening and testing, and make sure you're doing follow-up on all blood lead levels 3.5 or higher. I didn't go over the clinical piece of that, but there are very clear guidelines from CDC on if a blood lead level is at this, you should be doing a follow-up test at this interval. So that is all on our website as well. So check that out if you're not sure. And then just wanted to highlight again that you all are such vital partners in protecting, improving, and optimizing the public's health. So thank you for all that you do and all of your partnership with us. So I think we will now go to any other questions that came in through the chat.
Yes, we have several questions. So I've been trying to keep track of them. And I do want to just clarify because I received confirmation kind of in the middle of the webinar here that an out-of-state doctor needs to use an Illinois form for both the physical exam and the vaccines. So many of you were echoing that. We did just want to confirm. So I want to make sure that we clarify that. Amanda asked a
Oh, Julia, I just wanted to make sure that you see the questions in the Q&A as well as. Okay,
Yep.
great.
Yep. So Amanda asked a question in the chat about what to do as a school nurse with a child health exam form that does not have any information from the provider on it about the developmental or the social and emotional screening. So that's a really, really great question, and actually something that we as a team have noted about the form that that is a little bit confusing. Developmental screenings are typically for your early childhood population. So if a school nurse is overseeing that child health exam form and there's nothing marked about a developmental screening and the child is in an early childhood age group, the school can decide to recommend a screening for that child kind of through the way that they normally would through their special education or multi-tiered systems of support system. And the same answer goes for a social and emotional screening. So if there is no indication or mark on the social and emotional screening section of this child health form, that doesn't change the child's ability to attend or enroll in the school. And the school is able to have a social and emotional screening done either through the policy that is governed by IDPH, which I'll put a link to on our website. So that's one way that if the school nurse or school team believes that child needs a social and emotional screening, they can do it. Or many schools, as Dr. Weiner can attest to, have their own policies and practices for regular social and emotional screening. And Dr. Weiner and a team from ISB, as well as IDPH members, are working on universal mental health screening at the state level starting in 3rd grade. So Amanda, I know that you may have some more follow-up questions there, but I just wanted to note that. So
and Julia, I just wanted to point out too, so IDPH does have a webpage on school health, and it does outline what a school can do in terms of doing the screening yourself if it's not on that form. And so we will make sure to share out the link to that page too when we send out the materials.
All right, so now I want to go to, there's been several questions about religious exemptions in the chat as well as in the Q&A. So, and then I did also confirm through a note from our legal team at IDPH that religious exemptions need to be obtained for each grade that vaccines are due, which is a little bit different than the school health exam form, which is, well, it aligns to it, right? So Jen, I'll let you say a little bit more about that, but I don't know if you were able to read one of the questions in the Q&A section that came in about religious exemptions as well. Do you want me to say it out loud so you don't have to?
Yeah, that would be great.
Many physicians refuse to sign the religious exemption form and parents submit them without that signature. They're typically accepted locally by our school officials without the signature for that reason.
Yeah, the schools should not be accepting it without that clinician's signature. So it does require that clinician signature for it to be a valid form. And if you have other questions or need resources, we can talk more about that. But again, for the clinicians out there, your signature on the form isn't saying that you agree. You are, and it says it pretty clearly at the bottom, you are saying that you counseled the family on the importance of vaccinations and the risk of not getting vaccinated. So just something to keep in mind there.
So thank you all for bearing with me as I am just kind of checking out some of the questions. So there's a few questions in the chat, actually several about lead. One is a comment and maybe a question also. DCFS mandates that all Head Start enrolled children need to be tested, not just screened. DCFS requires testing at 1 year and 2 years of age. We struggle in Central Illinois getting medical providers to do this. And then also a note asking, is it okay to check lead at 9 months or should it be done at 12 months? Do you have to fill out the lead screening form if they live in a high-risk zip code or just test? So I'll stop there because I kind of said 3 things and see if you have some responses, Dr. Sa.
Yeah, that makes sense for Head Start because I think many of those children are eligible for Medicaid. If you are having trouble, feel free to reach out to us and we can talk more about additional engagement or resources we can do for your area to ensure that the children have access to lead testing. And then, sorry, what was the other? There was another piece of that.
Question about
9 months.
9 months versus 12.
Yeah, I mean, some children may need to be tested at 6 months too. In terms of the requirement to go to daycare, I would have to double check, but the language in the law says 12 months, that you must test at 12 months. So if a child was tested at 9 months, you may need to retest again at 12 months or some interval. We can double check and confirm that.
And then do you fill out, so I have 2 other questions about the questionnaire. Do you fill out the lead screening form if they live in a high-risk zip code or just test?
The screening form is really a tool for you all to determine whether someone needs to be tested. If someone's already in a high-risk zip code and they're 12 months and 24 months, that you're done, right? You need to test them. Now, if they're older, if they're an older child, you would need to do the screening. Basically, it's asking, have they moved? Are there any new lead exposures? If there are new lead exposures, then they would need to get tested again. So 12 and 24 months, you could probably just skip it. You have to test them anyway. And then if they're older than that, I would recommend using the screening so you can determine whether they need testing or not.
Yeah. So, Jean, you asked a question about the questionnaire being given at every physical at age 6 and under. I'm not sure if that answered your question. If the test is warranted, then the proof of the test is submitted on that form, on the child health exam form. Okay, so then thank you all again for bearing with me. So let's see. Point of care testing is great and lessens the chance that children are getting tested. Lessens the chances that children are getting tested in a timely manner. What should schools be looking for or requiring in regards to the lead testing, pre-K and K? I'm not sure if that question is about a school building or about the students coming in, but the requirements for, do you want to answer that, Jen? Is there anything beyond what we've talked about with 12 and 24 months that schools should be looking for pre-K and K, just to clarify that?
Yeah, nothing in terms of the recommendations of when to test. I wonder if the question is regarding like if there's no result that was written down. I believe the way it's written, the requirement is like they need to show proof that they got screened and tested or tested. I think we would probably, and I've heard conversations, amongst our ISB partners and others, like in terms of how to navigate if that form isn't, like the result isn't written down, like whether you need to not let the child in. Let us get back to you on that because I know that they've been trying to navigate that question as well because sometimes the form is like partially complete, like they got tested, you don't know the result, you absolutely need to know the result to let the child in. But all good questions. And then again, if you do have questions, you can always reach out to us. We have a school health team here as well, or if your local school district has someone that you can reach out to, I would recommend doing that as well. Some of these like policy protocol issues, yeah.
Yeah, unfortunately, I'm just noting the time and there's several other questions that we haven't had a chance to get to. So I think that we will review the recording of this and review the chat and the Q&A and make sure that we send out lots of information to all of you when we send the slides out that's responsive to your questions, since it seems like there were several. I know you have to go, Dr. Weiner, thank you. So please note that if you popped your question in the chat or the Q&A, we did see it. I apologize that we weren't able to get to it, but it's clear that this is an important topic with lots of questions. So I want to be timely. And then there is a link to the webinar survey. Jen, I'm not sure if you have some closing remarks real quickly to say here as it's 1 o'clock already.
Sure. Yep. Just wanted to wrap up, remind you all that if you do want CME, please make sure to fill out the survey. The link and there's a QR code here, and then it will also be sent down. I believe it may be in the chat as well. And then just want to remind you, we do these every month. So we have another one coming up next month to talk about public health efforts to reduce cancer in Illinois. Please sign up for that fast fact. And then always a reminder to sign up for our siren alerts. This is the best way to get updates from us to make sure that you're staying abreast of any changes and recommendations. So thank you again for your time and for your engagement and your partnership. And with that, I hope you all have a great day. Thank you so much.
Thank you.